Queen Elizabeth Hospital in Kings Lynn had a visit from the former Health Secretary to see why they need a new building. Campaigners have to start work on the new Secretary of State, Sajid Javid. At the last count, more than 200 props are holding up the roof in parts of the hospital. It's a message which the North West Norfolk MP James Wilde had pressed home in the corridors in the chamber at Westminster. So what is his next move? Well, I'm pleased to say James Wilde joins us on the line this morning. Good morning to you. Thanks for joining us.
Good morning, Chris.
Now, I'm sure you were interested to see that the front page of the Sun newspaper on Friday, just like the rest of us, and with everything that you've been campaigning for, I wonder what your reaction was when you saw that.
Well, of course, it's frustrating having pressed to get that visit from the Health Secretary for quite a long time, to have had it and had a successful visit where he'd seen very clearly the real issues with props and had been struck by that and said that we need a long-term solution. Clearly, it was frustrating. Obviously, it was the right decision for him to resign. The people who set the rules have to absolutely follow them. And now we have to work with Sajid Javid to make the case. But of course, it's a compelling case, which is well known within government, within the Department for Health, within the Treasury, and within Number 10 as well. And that was shown by the £20.6 million in capital funding we've had this year. So Sajid Javid will be briefed on this issue, but there is a lot of activity that's already been gone on that isn't wasted, which will help us to build the case and hopefully secure the position of one of the 8 new hospital schemes.
Yeah, I mean, briefing is important and you've got to do it, and you've got to fight your corner and get your move across. But it strikes me that there's no substitute for the person who's going to be making the decision, the person who has ultimate power, actually seeing it for themselves. And you've lost that effect over the last 10 days now, haven't you?
Well, in recent months, we've met with the health minister who's leading on the capital programme. QEH are talking to the officials who are drawing up the criteria and the process for the new hospital scheme. I've raised this with the most senior civil servant in the department, who's responsible for allocating the budgets as well. And after with the Matt Hancock visit, I sat down with the Prime Minister and showed him the pictures. And I've raised that with him a number of times. So there's a lot of awareness there. Yeah, but absolutely, we need to make the case to Sajid. I wrote to him yesterday with the support of MPs from across Norfolk, Cambridgeshire and Lincolnshire to set out that compelling case and to seek a meeting once he's got his feet under the table.
We understand, of course, he's got a lot to deal with but because of COVID and July the 19th on the horizon. But would you like him to come and visit? Will you be pushing for a repeat of what you did with Matt Hancock?
Yeah, absolutely. I'd like him to come and see. He came to Kings Lynn during the general election campaign to support my campaign then in his role as Chancellor, and he'll be assured of a warm welcome in Kings Lynn. I think given all of the issues that he's inherited, the focus immediately is obviously on the pandemic and coming out of that. So we'll have to work on getting a meeting in Kings Lynn, but I will certainly be pressing for something in the House of Commons as soon as I possibly can.
I know you were in the chamber yesterday to hear his first statement as Health Secretary. What did you make of what he said, and what do you think he'll be like as Health Secretary?
I thought he was very clear in setting out that the 19th of July is really the target date for us now, that we need to restore our freedoms and learn to live with COVID. I think the delay was the right thing to do. Over 1 million more people over 40 have now been double jabbed, or will have been by the 19th as a result of that delay. So the protection's there. We're seeing some cases around, but the link with hospitalisations and deaths looks to be broken. I think in QEH it fluctuates between no patients and 1 or 2 COVID patients. So thankfully we're not seeing that. So now we need to press on. People have been incredibly patient. They've followed rules for such a long time, made huge sacrifices, and now we need to try and get back to normality and living with the virus. And I think that's what he'll bring, a very pragmatic and practical approach. And he comes from it with a broad perspective, having been Chancellor. He'll have the economy and well-being to the fore, as well as the direct health impacts.
We spoke to Norfolk's Director of Public Health, Dr. Louise Smith, on the programme yesterday, and she was saying that actually now cases in Norfolk are beginning to rise. She is concerned that we might be 2 or 3 weeks behind places in the country where that they have had a bigger rise, and 2 or 3 weeks behind puts us on July the 19th. So we could get to a point where we are reopening things and the final restrictions being lifted in Norfolk just as our rates are going up. It really is a difficult balancing act, this one, isn't it?
It is, and we need to look at the data. But I think the key point is that case rates and it previously led inexorably to hospitalisations and deaths. And at the moment, we're not seeing that because the vaccine is doing its job. So if people are getting cases, then they're not ending up in hospital, or if they do go in hospital, they're in there for a briefer stay. So that's the link that's been broken. That's where the vaccine is doing its job. So of course we have to monitor the situation. And Sajid Javid said in his statement yesterday, which I welcome, is that he's going to look again at the issues you've been raising in terms of schools and bubbles, where you've got 10% of children having to isolate. That's damaging their education, and we need to have a more intelligent approach in order to prevent the detrimental impact on people's learning from being forced to isolate when there's limited chance that they've actually been exposed to the virus.
And just a final point on the Queen Elizabeth, if we can, for those of us listening in King's Lynn, people for whom this is their local hospital, can you reassure them that all the campaigning, all the work that has been done up until now has not gone to waste?
Absolutely not. The Prime Minister is aware of this issue. The Chancellor is aware of this issue. Other ministers within the Health Department and the senior officials are aware of it. I think everyone who would have seen the photos of Matt Hancock standing there looking at the roof, that picture is worth 1,000 words, and that's a striking image which I took into Downing Street and put in front of the Prime Minister so he can see for himself. And I look forward to doing similar with Sajid Javid, and then hopefully getting him to the hospital as well. So the campaign very much continues. Our compelling case remains: this hospital needs to be rebuilt. We need a new hospital in King's Lynn because of the situation with the roof. Otherwise, we're going to be spending good money after bad on literally propping up the roof when there's the opportunity to do something more exciting, to deliver better healthcare that will support the also additional numbers of houses that are due in King's Lynn and West Norfolk. So we need this hospital. That case is as strong today as it was previously, and I'll keep banging the drum, and I know that the local community, the councils, the college and other people who are supporting the campaign will do the same.
Thank you for joining us this morning. North West Norfolk MP James Wild joining us with the latest on the campaign.